Welcome to the Quality of Life podcast, where we explore how hospice and palliative care may enhance quality of life for patients living with a serious illness. Here's your host, hospice and palliative care leader and educator, Dr. Millicent Burke-Sinclair.
Well, today we have a really special guest that is here to talk with us about pediatric palliative and hospice care. At Four Seasons, we're incredibly honored to provide this service, and we happen to have an expert with us today named Dr. Michael Barnett. So, Dr. Barnett, thank you so much for being with us, and I would love if you would be willing just to start out by sharing with listeners a little about yourself and your expertise.
Of course. Thanks for having me, Millicent. My name is Michael Barnett. I am a med peds physician. So I trained initially in both internal medicine and in pediatrics, and initially was double boarded in both of those fields. And then I went on to do additional training in hospice and palliative medicine. So I'm actually triple boarded in those three fields and maintain my board certifications in those. And have been active in our national academies, the College of Physicians and the American Academy of Pediatrics, as well as the American Academy of Hospice and Palliative Medicine. So I'm a fellow in each of those academies, which just means sort of ongoing commitment to learning and to advocacy and support of those communities. I have worked in serious illness care now for over 14 years, and over a decade of that was primarily spent inpatient, so spent in large academic centers doing inpatient palliative medicine, both with adults and with kids. And my additional training is actually in education. So I have a master's in education, and for over a decade led the physician training program at the University of Alabama in Birmingham, where we trained doctors to do hospice and palliative medicine. So I have a particular interest in not just training other clinicians in the work that we do in serious illness care, but now here at Four Seasons and doing rural work, I'm actually really interested in how we train our providers to work in this space, to work in the home-based space, and to work in the community, not just in our big academic centers.
Well, that's a perfect transition into a question that I'm sure that many wonder, but why do you believe and why do you feel like the communities of Western North Carolina deserve and need and would benefit from having pediatric palliative and hospice care? Oftentimes we realize the necessity for end-of-life care, and we're growing with the understanding of serious illness care. But why specifically having a focus and expertise in pediatrics? Why is that important?
Simply put, because these kids live here.
Yeah.
That the truth is, whether we realize it or not, there are kids with chronic complex illnesses and with serious illnesses in all of our communities, in every town, and we know them. And when we stop and we think about it, we know them. They go to our kids' schools. They're in our churches. We've seen them, and these families are trying their best to provide the right care, to provide the best care for their kids, and the hard part is that for many of these families, they're spending significant amounts of their time and significant money traveling to get care. And when we think about Western North Carolina, we think about families that are spending so much time and so much money, traveling to Chapel Hill and Durham, to Charlotte, where I'm at in kind of the far west, right? My families are traveling. They're having to go to Chattanooga or to Atlanta. And not only are they dealing with the stress of a sick kid, but now they're having to go to unfamiliar cities, away from their family, away from their friends, away from their faith communities, away from what they know, to try to get the right care for their kids. And the truth is, we can provide that care here, and we can help them stay in the place that they love and that they're supported. That's why we need pediatric palliative care in Western North Carolina.
So incredibly well said. I mean, I think if we were to put ourselves in the shoes of any of those family members, what you said makes such sense. We need to feel like we are at home with our community, able to have the care around us that our child so much needs. And so when I think about that, I'm so grateful that Four Seasons provides that. But listeners may be wondering, okay, what are some diagnoses that you often see with pediatric palliative patients, and then perhaps even separate with pediatric hospice patients? Could you share a few of those diagnoses?
Yeah, it's interesting because in the adult world, we saw this shift. I mean, hospice has been around for 40 plus years. And originally, started really kind of in the advanced cancer world. Yes. And so many hospice patients initially were solid tumor, end-stage cancer patients. And historically, pediatric hospice has also been a lot of cancer. That's sort of what people think about. That's the diagnosis that they go to, and that's where the referrals come from. When we look at referrals actually to palliative care, to pediatric palliative care, there's a significant shift that has happened where at our inpatient, our children's hospitals, the consults that they're receiving, the greater percentage now are coming from progressive neurologic conditions, neuromuscular conditions, issues related to extreme prematurity, genetic and chromosomal abnormalities, so things that are happening from birth and abnormalities in development. And those, because of our improvement in technology and medicine, these kids are living no longer. They're making it further along into their childhood, but they have significant symptom burden. And psychosocial stressors on them and their families. And so those kids are getting referred to palliative care. And now that we're keeping these kids alive, they're now making it into the home space. So increasingly on the palliative care side, we're starting to see more of these other conditions besides cancer. We're still seeing pediatric cancer. But fortunately, as our survival statistics have improved so much in pediatric cancer, we're seeing less cancer and more of these other conditions proportionately. And I think what we'll see over the next 5-10 years is we'll actually start to see those kids eventually start to make it into the pediatric hospice world.
As you were talking, it made me think about what, in a sense, this is a loose term, but I'm using it intentional for a moment, what a gift it is to have palliative care available for the families and for the children. Because as you were mentioning about the different diagnoses that oftentimes you would see in hospice, I think for a family member, for a parent, it has to be reassuring to say, okay, I can have someone with expertise help me. Whatever it is, get the care, receive the care, cope, learn, figure out what to do. So often we hear from family members that I just have no idea where to start. And so I wondered if you might even be willing to share with us if a parent might be listening, or if a family member were listening, how could they get started with just finding out more about our pediatric palliative and hospice program? Because one of the things at Four Seasons is we never want someone to feel like, I don't know what to do, because we want them to know it's okay for you not to know what to do, but you're not alone. We're right here with you. So what would you say might be a couple of steps to first take?
I think one of the biggest encouragements is that the words don't need to be scary.
Yeah.
That so often we sort of associate hospice with the end of life, and for many of us, we've experienced that as something, hours or days, to the end. And so we very much have in our mind that it's sort of an immediate at the very end. And right, we know that that's not true. We're still talking about a 6-month window. We're talking about a lot of life, and even more so in palliative care, right? That it is longitudinal, and we may talk some more about that, sort of some of the differences with kids, but it is not just about stopping things and giving up and end of life. It is about abundant life. It's about fullness of life. It's about making the most of the situation that we're in. And so part of it is just sort of acknowledging that it's sort of scary to sort of think about and talk about. But like you said, Millicent, we need help, right? Like I'm a mom, I'm a dad. I know that we're struggling, that I see my child with these symptoms that are suffering, or I know we need help. I just don't know where the resources are. I think one of the biggest things, for us in Four Seasons is I've been impressed with the ability just to reach out and just say, hey, I don't know what I need. Can you just help me? And just pick up the phone.
It's that simple. We really do just want people just to pick up the phone.
Yeah. Just call. Yeah. And we'll help think it through.
Yes.
Like we want people to get the right care at the right place at the right time. And we'll help figure that out with you and what that looks like.
Well, and I would say you said it perfectly. We want to remove the burden. We realize that, families have a lot of burdens already. And so it really is just call. Mm-hmm. We're here. And, you mentioned something earlier about some of the diagnoses in palliative and in hospice pediatric care. I wonder if you might talk just a little bit more about the difference between pediatric palliative and pediatric hospice care from that of what one might traditionally think of with adult care in the palliative and hospice realm.
We talked about it a little bit about sort of, historically a lot of cancer and hospice being very much end of life in the adult world historically. One of the big challenges around how hospice is paid for and structured and codified is that it's prognosis based. There is a window, which is relatively arbitrary, of 6 months that says, okay, this is when these care needs begin. And pediatric palliative care actually, I think, has been a leader in our field of sort of acknowledging that needs don't magically start at 6 months. Symptoms don't start at 6 months. That really what we need is a model of care that is need-based as opposed to prognosis-based. Now that's a complicated conversation, but what that looks like in pediatric palliative care compared to adult hospice and adult palliative care is that in general, pediatric palliative care tends to be much more longitudinal for a couple reasons. And one is that kids are resilient. Mm-hmm. So we're pretty used to some of our older adult patients who have a serious illness and also have frailty or have a lot of other comorbidities. So even though they have cancer, they also have dementia. They have other things. And so that makes their ability to bounce back from an exacerbation a lot more difficult. But with a kid who, depending on their condition, may have a really healthy heart, really healthy lungs. Mm-hmm. The rest of them may be working really well. And so kids tend to bounce back, and kids can tolerate really serious illness, really significant declines, and bounce back and surprise us. Prognostication is inherently more difficult in pediatrics, which means that we're already thinking less about a prognosis need or a prognosis trigger and more about a need trigger. We will follow these kids for a long time. I think another big difference in pediatric palliative care and hospice compared to the adult side is that pediatricians and pediatric subspecialists tend to stay involved. Yes. So much more common in the adult world that when we finally get to a place where we don't have any more disease-modifying therapy or cancer-directed therapy, that subspecialists will often sort of hand off to palliative or hand off to hospice and say, hey, I'm available if you need me, but I'm not going to be actively involved in the management. And on the ped side, we tend to be a little bit more possessive and a little bit more involved because oftentimes we have grown up with these kids. Exactly. We have followed them for years. And so very common for us to keep our pediatricians, to keep our subspecialists and actually work together as a team as we're developing a serious illness care plan. So families don't need to worry that, I'm going to lose the docs and the nurses that I love. No, we're just expanding the team.
And that's a common question. So I love that you just said that. They might love who they are used to and feel confident. We just get to add another layer of confidence and support.
And so that's true for palliative care, for the whole spectrum of care. And then when we look specifically at pediatric hospice care, one of the biggest differences between the peds world and the adult world is that of concurrent care.
Yes.
And so this came about as part of the Affordable Care Act, sort of a lesser known part for many folks, that within that bigger law was something called concurrent care for children. That was a federal mandate that created a structure for kids who were on state insurance to allow them to continue receiving life-sustaining or curative therapies while enrolled in hospice. And part of the reason that this came about is because for most kids, we're going to continue things up to the very end. We're going to try our best for as long as we possibly can. And what was happening is that kids were never getting the good pain and symptom management, the good psychosocial support, the grief and bereavement support that they really needed, that their families needed. They were dying and missing out on all of that. And so he said, well, what if we could get them that? What if we could get them onto hospice and start getting them all of those extra things while still continuing their chemo or continuing this? And so concurrent care for kids who are like on Medicaid, who are on state insurance, allows them actually to have these dual goals, to focus on comfort and to focus on cure at the same time.
That's just tremendous. Wow. And that also has to give reassurance to the families that, you know what, we're here to provide extra confidence and you're having additional support. And it's possible to do both.
That's right.
And, that makes me actually think about another question, special needs that a child may have sometimes may feel out of reach for being possible at home. But my question is, what special needs might a child have that can be taken at home if they're under palliative care or hospice care?
Yeah. So it's amazing. Even the time that I've practiced medicine, what we were able to do at home and the complexity of care that we're providing at home has just grown considerably. And for a lot of our kids with complex, chronic, and serious illness, not only are we dealing with the serious illness and the symptom burden and constellation of symptoms that may come with that, but there's all the other stuff that comes with being a kid and growing, and for kids who may have developmental issues, feeding issues. We want to provide all the right care that child needs, and that may be, assistance with feeding and special chairs and so stuff that is often sort of not thought of as part of sort of hospice or what is the fundamentals of what hospice provides in terms of symptom management, but it's going to be a big part of taking care of a seriously ill kid. And so figuring out how to, like we talked about, how to partner with pediatricians and local agencies and Medicaid and rehab services to get kids what they need. I think another unique, special challenge for pediatric palliative care and hospice is pharmacy. Yeah. This is always on my mind, living in Bryson City and out in the far west. We take for granted, especially at our freestanding children's hospitals, at our big academic centers, those are often in metro areas. They're in fairly big cities. We take for granted being able to get the right medicines for kids at any time. In those big cities, very common to have 24-hour pharmacies, or a lot of these health systems have their own pharmacies because they're so large. Where I live, right, not only are there no 24-hour pharmacies, most pharmacies close at 6. Most aren't even open every day of the week because they can't staff them. And of the pharmacies that do exist, most of them will not fill pediatric medications because for kids, they often require special elixirs and solutions, liquid medicines, or they're so small that they require compounding. So they require making special dilutions of the medicine to give to that 1 month old. And so for us, where are those pediatric pharmacy resources? And they may be more than an hour away, the pharmacy that is able to fill those medicines. And when we're coordinating care with our children's hospitals and these kids are coming home, that's something that's often not on the radar for the folks back in the city.
So talk a little bit about how Four Seasons can help with that.
Yeah. Care coordination is a huge issue. That's a huge issue for all people with serious illness. It's even compounded more with pediatrics where you're, like I said, managing complex issues around pharmacy and medications, complex issues with multiple providers and multiple subspecialists. I think one of the things that I love about Four Seasons is that we provide this care and we live in the community.
Yes.
Right. I live in Bryson City. This is my community, and our nurse practitioners live in the community. We're here. And I don't think that can be taken for granted or overstated, because, like I said, knowing which pharmacy can do this, knowing where is there a provider comfortable taking care of a complex child, right? There are very few pediatricians. Where are the pediatricians or family medicine doctors that are even comfortable taking care of that sick of a kid? And that may not be in that town. And so the benefit of Four Seasons and the benefit of our providers living in the community is that we're connected to the community and we know how to find the help that these kids and families need.
And I think that is just a beautiful example of how that confidence can be raised in that family when they reach out to Four Seasons, because we know how to support. We have the connections to be able to provide more support. And in fact, it makes me think about a question that oftentimes we're asked is, how does pediatric care support the caregiver and even beyond with the family? So you've given multiple examples. Are there some other examples that come to mind?
One thing that I love to talk about is the concept of the good parent. So this has actually been described in the literature now for a number of years, and when we think about raising our kids, and we think about sort of what my role is as a parent, it's to feed them and grow them and get them to adulthood. And so what happens when I have a child that is seriously ill, or a child who may not survive, who may not make it? Fundamentally, there's this sort of feeling that I've failed as a parent, that I didn't do what I was supposed to do. And we have the opportunity as providers taking care of these amazing kids and families to really speak support and encouragement into these parents' lives and tell them that they are doing an incredible job, because there is a lot that they're doing. They're advocating for their child. They're keeping their child comfortable. They're teaching them values. They're loving them. They're being by their side regardless. That's what it means to be a good parent. It's a broader definition. And increasingly what we're seeing is that reassurance, they're not empty words, that actually reassuring, you are doing an amazing job, Mom. She wouldn't be here today if it weren't for you. That those words not only help provide emotional support now, but actually help in bereavement, that they may actually reduce morbidity, reduce the risk of sort of complicated grief post-death, just with those reassurances up front, that those words matter, and helping these caregivers to realize they're doing so much. One thing that we will continue to do is help take care of parents well beyond those immediate needs, and even after their child is gone, providing support for them, support for their family, and support for siblings. And that's another thing that is unique to pediatric palliative care. in pediatric hospice we don't think about a lot is the experience of siblings who have a seriously ill brother or sister. They're often sort of forgotten in the mix, and Four Seasons is intentional in reaching out and supporting those siblings as well, meeting them where they're at and continuing to provide support as their siblings' illness trajectory changes.
You know, there was so much about what you said that just seemed to exude reassurance and comfort. When I think about calling Four Seasons, if you have a pediatric need, to me, we provide education. We provide support. We provide comfort. We provide guidance. We provide a team of expertise that come alongside of you to make sense out of what's occurring, but also be there. So oftentimes I think people may be unsure of the next step or how to even get support for themselves. And so it's really meaningful that you shared sometimes that mom, sometimes that dad, sometimes that grandparent, whomever is significant in that life of that child just needs to hear you're doing a good job, or here's how we can help you. You know, oftentimes as adults, finances can be a challenge. And certainly when you're thinking about, I have this child that I need to do everything that I can to provide for them, and don't know that I can afford all that's needed. That's a huge burden. And so it makes me think about some years ago, we created the Four Seasons Foundation. And we created this because we wanted to ensure, just like back in 1979 when we originated, that anyone who needed access to care had it, regardless of their ability to pay. So could you talk just a little bit about how perhaps the generous philanthropic givers and donors within the community and grants and so forth help make the care we're talking about possible?
Not only is providing pediatric palliative care and hospice, complex, right? That these kids often have, special needs, special equipment, much of which is expensive and cost prohibitive for families who are already forking out so much money just in gas and lodging and trying to get their kid to appointments and
probably missing work sometimes.
A lot of missed work and and the I think compounded because of our area. We have kids who are crossing state lines to get appropriate care fairly routinely. I've encountered this already with kids who are not enrolled in Medicaid in the state of North Carolina and struggles with, well, if they go to Tennessee, what's going to be paid for? But their care's all been in Georgia and now they're back home in North Carolina. And so and we help with that, right? Yes. Our social worker, our team helps to get this paperwork done and get folks plugged into the right resources. As anyone knows who's gone through this, it takes time. None of that happens immediately, but this child has needs now, right? We can't say, well, we'll start taking care of you 3 months from now when your application goes through. Their needs now. And so foundation support, community support is what allows us to start providing the right care now, while we continue to find resources and continue to make sure that this is sustainable for this child and for this family. But I think that's a great example.
Well, and that honestly just brings tears to my eyes, because if we put ourselves in the shoes of the family members with a child who has a serious illness or is facing end of life, we need someone to say, it's okay. Let me help you right now. Not let me help you 6 months from now. Let me help you now. And so I want to encourage our listeners that there is hope and there is help. All you have to do is call Four Seasons. And in fact, as we culminate our time together today, I wonder if you may have a story that could provide an example of how hope and help really did make a difference or make an impact in the life of someone that perhaps we've provided care for.
Yeah, one story that comes to mind already and is ongoing, and we're walking this road with this child and with this family, is a patient, far in the West, in one of our kind of rural communities there. And the initial sort of contact came from the docs at Emory, and just an email. Hey, Michael, we have a kid who really needs help, who we've been taking care of, just got this really complex diagnosis. It's new. Everyone's sort of wrapping their mind around it, but they live out by you. Do y'all have support for this child? And immediately it was, of course we do. Yes. And let's figure out what they need. And what actually was neat was, I primarily work on the hospice side and do home visits and see patients who are on hospice. And our nurse practitioners are routinely seeing all of our palliative care patients at home. And we were able to do a joint visit and go together, the nurse practitioner and me, and meet this child and meet this family together and sort of, find out where they're at and find out what they know and sort of find out what's most important to them and kind of start thinking about the future. And in many ways, it sort of, it demystified it. It sort of made it less scary. It's like, these are the resources that you have here in your community. These are the faces. And we'll be able to adapt and change as our needs change. And really kind of reassuring this family who is well known in the community, has great family support, has great church support, that we're going to work with what we already have, right? Let's figure out where the gaps are, whether, where we can educate, where we can provide extra resources and fill in the gaps, and especially as this child's symptom burden starts to grow, and as these trips across state lines, and as those get harder and harder to do, and we start to think about, is that what we're going to keep doing? Are we going to start to move sort of more of our care back home and actually letting family know that's an option?
That's possible.
Yeah.
Well, so for our listeners, if you are saying this is touching my heart, I need to call. We want you to call because we are here for you. You are not alone. And that's the beauty of Four Seasons services, is that all you have to do is call, and we can help so many people all throughout Western North Carolina now. So give us a call. Feel free to visit our website at www.fourseasonscare.org. Thank you so much for being with us today. And thank you to our listeners.
The Quality of Life podcast is produced by Four Seasons, the care you trust, providing award-winning quality hospice and palliative care to Western North Carolina. For more information, visit fourseasonscare.org or call 866-466-9734.